Age-related macular degeneration, also known as AMD, is the deterioration of the center of the retina called the macula. The macula is the part of the retina which is responsible for our central vision and our ability to see color and fine detail when looking directly at an object. Age-related macular degeneration, or AMD, is the most common cause of vision loss in people over the age of 55. In the early stages of AMD, there is little or no vision loss. As the disease advances, images can become blurred or distorted, or a dark or empty area can appear in the center of the vision. AMD does not cause total blindness because sight vision is not affected. There is some good news related to macular degeneration. With regular checkups, early diagnosis, and new treatment options, doctors are now able to maintain visual acuity in most patients and improve vision in a significant number of patients suffering from this condition.
The most common form of age-related macular degeneration is called the dry form. This form of the disease affects up to 90% of AMD patients. In the early stages of dry AMD, tiny deposits called drusen start appearing within the retina. These drusen may be so insignificant that the patient has few, if any, outward symptoms and no vision loss. As dry AMD progresses, more disruptive drusen begin to appear. As the size and number of drusen increase, patients may begin to notice a small dark spot in their central vision, causing them problems while reading or driving at night. Drusen alone are not proof of macular degeneration, but they are an important warning sign. It is critical for patients to understand that as dry AMD progresses, it can turn into the more severe form called wet AMD. This form of the disease affects about 10% of AMD patients. In the wet form of age-related macular degeneration, abnormal blood vessels begin to develop underneath the retina. These abnormal blood vessels are unusually delicate and may bleed or leak fluid. This fluid builds up beneath the retina, causing it to bulge or lift up from the back of the eye. The eye is damaged as a result, causing central vision to appear blurred, wavy, or distorted. Wet AMD can progress rapidly, leading to severe vision problems in the affected eye and causing permanent vision loss. Early diagnosis of wet AMD is critical.
While macular degeneration is a common cause of vision loss, early detection and timely treatment can help delay its progression and preserve your vision. Vision that is lost due to macular degeneration can significantly impact a person's lifestyle, so prevention is an important part of treating this condition. You can play a part by leading the healthiest lifestyle possible. Quit smoking, control your blood pressure, watch your weight, and exercise.
Research indicates that too much exposure to sunlight can cause or accelerate the progress of age-related macular degeneration. This means that patients who already have AMD or who are at risk should wear sunglasses in bright light, especially sunglasses with UV and blue light filtering abilities. Patients already wearing glasses may want to consider either purchasing a UV filtering clip-on or a separate pair of UV-protected sunglasses. One study, known as the Age-Related Eye Disease Study, AREDS, has shown that multivitamins, rich in nutrients called antioxidants, plus eye vitamins and minerals, can actually reduce the risk of progression of moderate to advanced AMD and its associated vision loss. Vitamin C, E, and A are nutrients rich in antioxidants. They are most abundant in dark green leafy vegetables, such as spinach, red foods such as peppers, and orange foods such as carrots. While eating foods rich in antioxidants may help, the ARID study also offers indications that people at higher risk of AMD should take additional nutritional supplements of zinc and copper. Newer research has shown that supplements of zeaxanthin and lutein are also important for AMD risk reduction. Clinical studies have shown that among those AMD patients most at risk, taking the prescribed combination of nutritional eye vitamin supplements can help preserve eye health and reduce the risk of having the disease progress to a more advanced stage. Ask your eye care professional which multi-nutritional eye vitamins are right for you.
During the early stages of treatment, your eye care professional may write a new prescription for your eyeglasses and ask you to schedule regular eye exams. You may also be asked to use an at-home eye test, called an Amsler grid, to monitor for changes in your vision. Although dry AMD is far more common than wet AMD requires timely diagnosis and aggressive treatment. Some patients are good candidates for medications that are injected directly into the eye, which are called intravitreal injections, as it allows the medication to be placed much closer to where the disease is occurring, while decreasing the risk of side effects. Intravitreal injections are commonly used to treat retinal diseases, such as macular degeneration. Intravitreal injections are typically performed in an eye care professional's office. Once the eyes are dilated and examined, the actual procedure only takes about 15 minutes. Before the actual injection, drops are administered to numb the eye and help prevent infection. Next, a small syringe is used to inject the medication directly into the vitreous cavity. Patients may feel slight pressure on the eye when this is done, but they should not experience pain. After the procedure, the doctor will check the eye and place some eye drops in the eye to help prevent infection. Some patients may notice the appearance of floaters after the procedure, but these usually disappear after several days. Although intravitreal injections are able to maintain visual acuity in most patients and improve vision in a significant number of patients, injections must be administered as frequently as every month to attain the best results.
While there is no cure for wet age-related macular degeneration, patients do have treatment options that may prevent or halt the progression of the disease. If wet AMD has developed in areas close to or underneath the center of the macula, then photodynamic therapy, or PDT, is the preferred option. During PDT, a laser is focused through the eye and onto the retina. The laser comes in contact with a special dye that is injected into the bloodstream, which then reacts, sealing the abnormal blood vessels to prevent further damage to the eye. The major advantage of PDT is that the laser uses no heat. This prevents damage to healthy tissue surrounding the area to be treated, allowing the procedure to be repeated multiple times if necessary. PDT rarely has any side effects, but it is important to wear sunglasses and protective clothing while outdoors for several days following treatment. There is a chance that abnormal blood vessels can grow back and may require additional laser treatments. If wet AMD has developed in areas away from the center of the macula, then laser treatment can be an effective option. During laser treatment, the laser is focused through the eye and onto the retina. The laser destroys the abnormal blood vessels located underneath the retina to prevent further damage to the eye. One advantage of laser treatment is that the procedure is not repeated on a regular basis like other treatment options. There is a chance that abnormal blood vessels can grow back and may require additional laser treatments. Laser treatment is not a cure for macular degeneration. After treatment, it is important to check one's vision regularly using an at-home test